My name is Louie Duran. I'm a retired social worker, actually a probation officer. I worked for Los Angeles County. Uh, I have been retired for 25 years, and I've been a member of the Alliance for Retired Americans since its inception. I was around when it started. Because of the fact that I got to go to school and was able to get into the professions, I had an excellent job with really good retirement benefits, including 100% medical coverage. So my Medicare and Social Security are secondary. I'm one of those very fortunate people who benefited from what the labor movement did for this country. My parents, however, is a different story. My father uh, had a variety of illnesses in his late life. He was almost never sick during his working career, but after he retired, he started getting sick, and he had a thyroid cancer, for instance. He had to undergo a 7-hour operation. He could never have afforded that without Medicare. He spent 30 days in a convalescent hospital. No way he could have done that with on his own resources. It was Medicare that kept him alive as long as he lived. My mother was a similar story. She was an amputee. She had to have her leg amputated below the knee. That would not have been necessary if Medicare had been around at the time when this disease developed, because she had osteoporosis in her ankle, and the doctor she was going to misdiagnosed that, and for 6 months she suffered with that before she got to orthopedic hospital. They diagnosed it correctly. By that time it was too late to save her leg. She had to have it amputated and lived many years as an amputee. If she'd had Medicare, I believe she could have had that leg. She could have saved that leg. In her later life, she developed lung cancer. Twice she had to undergo extensive treatment for her cancer. Finally, it finally killed her, but it was a long time before it got her, and because of the care that she was getting on Medicare, she fell and broke her wrist. She had an excellent orthopedic surgeon reconstruct her wrist so that she had full use of her hands. She fell and broke her knee. She had to have 3 operations to repair the patella. She would not have been able to afford that prior to Medicare. Medicare has meant a good deal to our family. Even though I don't benefit from it, I care about it. The t-shirt I'm wearing now says, "Healthcare, Medicare, I care."